Welcome to our presentation on homeopathy.
Homeopathy is a 200-year-old alternate medical practice that aims to stimulate and strengthen the body's own natural healing processes.
Homeopaths describe their practice as holistic and effective as it takes into account the history of the disease and personality, lifestyle, and hereditary factors.
This video will investigate the guiding principles of homeopathy and also evaluate the efficacy and legitimacy of homeopathic treatments.
Let's begin with the social and cultural dimensions of homeopathy. Homeopathy's guiding principles emerge from the findings and writings of Dr. Samuel Hahnemann in the early 19th century. Upon graduating from medical school, Dr. Hahnemann was disillusioned by the use of purging, bloodletting, and the use of toxic chemicals prevalent in medical practices at the time. Inspired by William Cullen's Materia Medica, he began investigating the law of similars. In his initial experiment on the treatment of malaria via cinchona tree bark, he observed that the fever, shivering, and joint pain resulting from the bark's ingestion was very similar to the symptoms of those experiencing malaria. Upon studying a number of similar cases, he postulated that all effective drugs produce symptoms in healthy individuals similar to those of the diseases that they treat. In doing so, Dr. Hahnemann aimed to treat diseases by stimulating and strengthening the body's own natural healing processes. Dr. Hahnemann also theorized the concept of miasms as infectious principles underlying chronic diseases. The underlying imputed miasm would essentially still remain with conventional medicine, and hence deep-seated ailments could only be corrected by removing the deeper disturbance of the vital force targeted by homeopathic medicine. Now let's talk about modern-day homeopathy. Modern-day homeopathic medicine has evolved to involve a number of key steps that help in diagnosing and treating diseases. Step 1 involves detailed examinations of the patient's histories, including questions regarding their physical, mental, and emotional states, their life circumstances, and any physical or emotional illnesses. Step 2 involves a homeopath consulting the provings, which contain the profiles of different homeopathic preparations. These are found in A, the Materia Medica, which is a collection of drug pictures that describe the symptom patterns associated with individual preparations, and B, the repertoires, which list preparations associated with specific symptoms. Step 3 involves animal, plant, mineral, and synthetic substances which are used in preparations whereby different amounts of these substances are crushed into powders. Step 4 involves powders which are diluted using the C scale, diluting by a factor of 100 for every C value. This ensures safety as many of the substances are toxic in higher doses. Let's move on to homeopathy's appeal and use.
Originally, the popularity and demand for homeopathy largely stemmed from the minimally invasive and convenient nature of homeopathic treatments. Modern-day appeal largely stems from digestible rhetoric and personal anecdotes, rather than scientifically verified principles. The long consultations are also essential in building rapport.
As can be seen in the graph, most consumers of homeopathy are largely in India and other developing nations. This may be due to the relatively low cost of many treatments in comparison to conventional medicine. Also, this may be due to strong cultural and religious beliefs and general disenchantment from conventional Western medicine in developing nations. So how effective is homeopathy?
Despite the extensive use of homeopathy over the last 2 centuries, the efficacy has always been a controversial issue. As such, several arguments for and against have been raised.
Arguments for homeopathy. In 192 randomized controlled trials that tested 81 different medical conditions, 21 showed clearly positive and 29 tentatively positive health outcomes. A study of 6,544 patients seeking care for chronic conditions presented positive health outcomes, and in more than 70% of the cases showed high satisfaction rates. To add to its legitimacy, production of homeopathic medications is regulated by high national and international standards of quality control, such as the TGA and internationally accepted homeopathic pharmacopoeia. Furthermore, homeopathy is more cost-effective because it's cheaper than conventional medication and has the potential to limit the overuse of conventional medications, such as antibiotics. Arguments against homeopathy. In 2010, a review by Edzard Ernst evaluated several criteria in numerous reviews regarding the effectiveness of homeopathic treatment on consumers. These criteria included the number of clinical trials reviewed, number of participants involved, and the conclusions that they reached. 5 out of the 6 studies reviewed by Ernst showed no proven benefit and thus failed to provide sound evidence for efficacy regarding homeopathy. Whilst the study on cancer showed compelling evidence initially, it was later discounted as remedies were not highly diluted. Furthermore, in 2015, the NHMRC stated that there are no health conditions for which there is reliable evidence that homeopathy is effective. Additionally, in 2013, Australian Register of Homeopaths made a public statement acknowledging that homeopathic preventative immunisation treatment lacks evidence for efficacy compared to conventional immunisation. Impacts on consumers and the healthcare system. The main concern is the indirect harm caused by stopping or delaying the use of evidence-based treatment in favour of homeopathic ones. For example, Penelope Dingle died from bowel cancer in 2015, having spent approximately $30,000 on homeopathic treatments. Consequently, this may be costly for the community, the individual, and thus the healthcare system as a whole. Therefore, it is imperative for patients to consult with a medical practitioner in order for them to understand that the efficacy of homeopathy in treating and preventing diseases is limited. Even so, healthcare practitioners should avoid its immediate dismissal due to its apparent irrationality. This is reflective of the bioethical principle of autonomy and beneficence, as healthcare practitioners should aim to respect the patient's decisions and ultimately do good for the patient. Therefore, meaning-centered approach is vital to understanding other beliefs and practices like homeopathy. Moreover, an explanatory model approach can greatly assist in exploring patients' health-related values and practices.
As such, it is essential that patients and clinicians alike make well-informed decisions when they seek homeopathic care.
Now, I will be discussing the correlation between homeopathy and a specific disease state, cancer. Homeopathy for cancer has become a popular option amongst oncology patients. Current data shows that approximately 1/3 of patients treated for cancer in France have been found to use some form of complementary medicine, with the near majority of those choosing to use homeopathy.
This sort of approval has led to studies being conducted to evaluate the effectiveness of homeopathy. Interestingly, in Switzerland, the demand by both patients and clinicians catalyzed the eventual subsidizing of homeopathy to be used with cancer therapies. Now, although there is a strong claim made against homeopathy and its ability to manage the natural progression of cancer, there have been a lot of randomized controlled trials and observational studies coming out over the past decade, documenting some key benefits that cancer patients can derive from homeopathic remedies. Those are better health outcomes when combined with conventional treatment, better survival rates, and even possible oncological benefits. These findings encourage clinicians to keep an open mind, as suggested by the researchers. Across multiple studies, with some shown here, results have consistently shown that the use of homeopathic treatment in conjunction with conventional medicine has given patients better outcomes across the board in terms of quality of life, mental health, pain severity and duration, and fewer side effects. Not only this, a study has been conducted by the Medical University in Vienna that has indicated that homeopathic remedies increase the survival rate across all forms of cancer when compared to medical prediction. The researchers attribute this to the better health outcomes and subsequent better adherence to conventional treatment. However, they remain conservative in their conclusion of its significance. Lastly, trials have shown that administration of doses of homeopathic medicines have had oncological benefits in inhibiting tumor growth in mice. Now, this is a very contested and debated topic, with many researchers and doctors condemning the research over exaggeration of results and poor methodology.
Ultimately, the fact still remains that an open mind must be maintained by all parties in light of these findings about homeopathy and cancer.
Now I'll talk about homeopathy and its relation to ADHD. ADHD affects 3 to 8% of all school children and is one of the most common childhood psychiatric disorders.
Currently, stimulants such as methylphenidate and dexamphetamine are the only viable evidence-based medicines for ADHD, being able to enhance short-term behavioral, academic, and social functioning. However, the adverse effects such as tics, insomnia, and irritability continue to cripple the well-being of children every year and has thus pushed parents to seek a safer homeopathic alternative. To evaluate the efficacy of homeopathy on ADHD, a pilot study was conducted to compare individualized homeopathic remedies to a placebo in a randomized double-blind placebo-controlled trial. Results highlight no differences between homeopathy and placebo groups in the homeopath's evaluation of the change in severity when tested on the Clinical Global Impression Scale. This is in congruence with similar behaviors exhibited between the two groups, because in both groups, inattention scores worsened significantly and there was no significant change in impulsivity. Through evaluation and appraisal, we have concluded that there is no difference between homeopathy and a placebo in the treatment of ADHD. Although this study had limitations such as insufficient statistical power, including a small variety of homeopathic methods and the number of physicians, the study design, randomization, and validity of this RCT study allows for a sound conclusion to be drawn. While homeopathic remedies for ADHD may only be a placebo effect, it has similar effects to methylphenidate and thus complements its evidence-based counterpart. The results of a placebo-controlled study showed 86 patients responded sufficiently to homeopathy, 25 needed methylphenidate, and 3 responded to neither homeopathy nor methylphenidate, thus demonstrating that the majority of patients experience similar therapeutic effects from homeopathy as they would with methylphenidate. From this study, we can effectively conclude that homeopathy has similar effects to methylphenidate.
To conclude, although there is no evidence to suggest a difference between homeopathy and the placebo, there is undoubtedly a beneficial effect that complements Western medicine.
So how should doctors approach homeopathy?
A recent rise in evidence-based practice has caused government organizations such as the NHMRC to restrict certain homeopathic practices due to a lack of evidence demonstrating its efficacy in vivo. Despite the rise of evidence-based practices, many people continue to utilize homeopathic treatments. As seen through the aforementioned example of cancer, homeopathy can in fact play a key role in improving the holistic experiences of patients during and after treatment when taken in conjunction with conventional Western medicine. Ultimately, people seeking health care deserve the right to choose whether they want to use homeopathic treatment or not. To resolve the conflict between homeopathy and conventional medicine, a meaning-centered approach needs to be undertaken whereby homeopathic and conventional practitioners discuss their perspectives with open-mindedness and in a respectful manner. In essence, this will allow for a better delivery of patient-centered care and ultimately lead to better health outcomes at a personal, social, and biological level.
That's all, folks.